Hi, my name's Liam Coffey from Muscle Doctor. And if you're a manual therapist, it's very likely that you've come across somebody with plantar fasciitis. It can be tricky to treat, but here I'm going to show you a K-tape technique that can help to manage the rehabilitation from this injury. For this, I'll be using Tiger Tape's Kinesiology Tape, which can be purchased at physique.co.uk. Let's see how it's done.
We're going to begin with the patient in prone, and they've got their legs elevated so that we can passively dorsiflex when we need to apply the stretch to the tape. Just make sure that everything's nice and clean. We can use soap and warm water and also some antibacterial hand gel. Make sure it's fully dry before then beginning to put the tape on. So let's tear about 1 inch from the end. This is going to create our anchor points. Peel off the middle backing strip, and let's place that somewhere near the end of the metatarsals before the phalanges. We don't want the toes getting in the way. And when that's on, passively dorsiflex the ankle. Apply about 50% stretch right over the calcaneus, over the Achilles tendon, keeping the backing strip on that top anchor. Gently press the tape in, make sure there are no creases. This is going to allow it to come off easier and sooner than it should. Peeling off the backing strip from the top anchor, apply that under zero stretch, and then peeling off the backing strip from the bottom anchor, again applied under zero stretch. So give that a light bit of friction with the backing tape to heat the adhesive and to help it stay on for longer, making sure not to put too much pressure into the affected area, which will be somewhere just around there. Taking a slightly smaller eye strip, we're going to tear the backing paper halfway down. Peel some of it back, but just keep some of the tape on the anchors. Passively dorsiflexing the ankle. We want to apply that tape under about 50% stretch, somewhere just underneath the calcaneus. Removing the backing paper, applying those anchors with zero stretch. And the second eye strip, we're going to go just above that. Again, tearing the backing paper halfway down, exactly the same as we did before. Again, 50% stretch with a dorsiflexed ankle. Use your leg to do it. Onto the calcaneus, making sure that we don't go too far behind because then it's going to make it more likely to come off. Apply that anchor point with zero stretch, and the same with the last one just there. So again, using that backing paper to give everything a bit of a rub to heat up the adhesive, to make sure that this tape stays on and doesn't come off. And then we have K-taping for the treatment of plantar fasciitis.